It's Ariel, the Client Service Director of Dental Nachos. I am here with Dr. J, and we are going to interview him about a position he has available in Media PA. And Dr. Nacho himself will be doing the interview. And here comes Dr. Nacho now.
Happy Friday dentisting hour for you guys. It's almost time for Mrs. Nacho and I to go out and get parenting medicine. That's wine for all of you guys there. Wine is what we call parenting medicine. I'm happy to be on here with my friend Dr. J, and we're talking about one of our favorite things. Tag some people on Facebook, getting bads. Getting bads. One of our mottos here, as you know, Jay, is more JBN, just being nice. But getting bads, baby age dentist bads, to connect with Jay. Jay, how long have you been a dentist for?
More than a decade.
So you are, like me, I'm 17 years, a medium-age dentist, you're a mad. So how can we connect these bads and mads together? And that's what we do at Dental Nachos. One of our toppings is to connect dentists together. Jay is an awesome dentist and has a job, a job for you young dentists or medium-age dentists who want to pay off your loans and learn. And what we do here on Associate Connections is ask Dr. J about his job, bring some of it to life. So first I'm going to say, Dr. J, tell us a little bit about you and your practice and where you're located.
So our practice is Media Dental Associates. We're located in Media, Pennsylvania. This is the practice has been here for a number of years, and we're a growing practice with a great number of colleagues or associates.
I like that. How many dentists work there?
We have about 3 dentists who work here together.
How many ops?
About 11 ops.
I like that. 11 ops. That's good. More ops, less problems. That's like the P. Diddy dentist song. More ops, less problems.
Absolutely. A lot more room to grow, and we're growing very well.
So my goal, I like to kindly annoy the dental community. My wife sometimes says I just regularly annoy her, but to bring us together for good reasons. So what I tell baby age dentists, toddler age dentists, when they go to look for a job, these are the 3 things they want to know. Why the dentist is looking for an associate, what procedures would like them to do, and how they're going to be compensated. So let's run through that. Why is your office, Media Dental Associates, Ariel put the website in the comments, why are you guys looking for an associate?
The reason we're looking for an associate right now, Paul, is because we're seeing really good growth with our practice. We're seeing a good number of new patients a month.
Awesome.
And we need an associate, so we can handle the patient care here and take care of the patients essentially.
So if I'm applying and I say, okay, how many days a week am I going to be working there, and what procedures would you like me to do?
Well, it's a full-time position. I mean, if somebody wants to start off part-time, of course, they can always come on board part-time, but we eventually like somebody to be here full-time with us, which is going to be 4 to 5 days a week. Procedures, we are I guess we like to call ourselves like a full scope of general dentistry, anywhere from simple fillings to, single crowns to bridges, implant placements, restorations, extractions, dentures, you name it. As long as their skill set is, enabling them to deliver, good quality care to the patients and do the kind of work they want to do. And
you guys can provide mentorship because you have multiple dentists there that can help.
Exactly. That is a big benefit of working with us.
I mean, when you bring a baby home from the hospital, it's you and your wife, you don't know how to work this thing. It's a new person in your house, but you have each other and you're like, is this normal? Like, I don't know, we should call someone. When you can have mentorship on site, it's so critical because you can just walk off and say this, my associate might come out and say, my implant crown is making the tissue turn white. And I say, that's okay. It'll turn pink soon enough, right? But to them, it's a huge problem. So that's on-site mentorship is important. While I am a very entertaining and engaging person, and people would watch me for hours, Jay, I want to make sure we put up your contact info. If they want to learn more, contact Ariel at dentalnachos.com, Jay at media.dental here. So we talked about why you're looking for an associate, growth, full-time position you have available. Now these young dentists, they have more loans than when we came out. It's challenging.
Oh, yeah.
This is what I like to say to patients. So I'm going to use this example for my dental people. If a patient asks me how long a filling is going to take, I say it will take 60 minutes. If I think 40 minutes, because if I'm done in 40, they think good job. If I go 1 minute over 60, it's a problem. So same thing with money. I like to talk about what's a baseline or a daily safety net. If someone worked for Media Dental Associates, they can make. And you were telling me $125,000 a year is totally achievable.
Absolutely, very easily achievable. Somebody who has a confidence skill set, even coming out of school, along with the mentorship we provide. I think that's something that a new dentist can comfortably look to make. Along with that, we also provide a daily guarantee of 500 very easily while they're
Right.
kind of getting their fingers wet and kind of getting a feel of the place and building up their book of business here.
And that's important. I believe owner to owner, I believe in the daily safety net guarantee because these are human beings with loans. They got to be able to
So
pay
everybody's
their
got
debt.
bills to pay, Paul, and I think that what
Yeah.
we offer as a daily guarantee, it really helps them kind of hit the ground running.
And just make sure that they know they have money coming in, because some of the things,
Exactly.
whether you have, even when you have a great need for an associate, they're the newest dentist there, they have the least patient relationships. It's not easy. They have to build up. So I think that's important.
Totally get it. Yep.
And you're saying you also do, like I do, a daily safety net guarantee, but also the opportunity to earn more. So they have the potential to earn more by being paid a percentage of what they do. Tell me a little bit about that.
Well, based on the once they start kind of getting more established into the practice, and as the production level goes up, then their pay obviously goes up because they're paid a percentage of the collections. Now, once they come in, we kind of try and figure out exactly where their the comfort zone lies, and we slowly start to kind of motivate them. We also give them great benefits, like we kind of help them out with the CEs along with the mentorship. So, which is great because as they start to kind of grow their skill sets, as they start to kind of establish their relationships and the trust with the patients, they're able to kind of diversify the procedures that they're doing. And with better procedures, better mix of services that they provide, their pay is only going to go up from there.
Awesome answer. And so if you're out there and you want to apply for this job, Ariel@dentalnachos.com, J@media.dental is how you can apply for this job. Always wanted to hold up a sandwich board. So Jay, so you pay for CE, which is great. I do too. So, and where do you live, Jay?
We live in Chester County.
Chester County. So that's in the Philadelphia. How far are you from Center City?
40 minutes, 45 minutes.
40 minutes. So and you're looking, so what I'm doing is I'm going to kindly annoy you in the audience because you reached out to me and said, hey, Dr. Nacho, Paul, you know me as Paul before Dr. Nacho. That was my regular life. I need an associate, right? And you think that I just have this, army of young dentists that follow me around and say, go work for Jay. So I said, I'm going to get you. I'm going to get you.
I think you have a battalion of people following you.
Yeah, a battalion of dentists. But and I love doing what we're doing right now. I really do. But what I love more than Facebook is face-to-face interaction. Okay.
Absolutely.
So you said you would like to take your associates to CE. Imagine if you knew of a CE course that was designed for dentists to get along, get together, talk about the clinical and business aspect, meet each other, and to have bads and mads all in the same place. Would you know anyone that runs stuff like that, Jay?
I know a guy. He goes by the name of Paul.
Yeah. So the Dentist and Team Boost Festival, right? The Dentist and Team Boost Festival is April 24th, 25th in Center City, Philadelphia. So I was watching the Muppet movie with my daughter, and the Muppets take my hand. All the Muppets come to one place. I bring in Mark Costas from Arizona, Kira Dent, Laura Hatch, Carl Kroner, people from Philly. I do all this work. I bring them in. I just need you to JSU, Jay, and the Nacho community. Just show up, because I have a subset. When someone drags you to a CE and you go afterwards, you know what dentists say? I'm so glad I went.
Absolutely. Every time.
Because while I pride myself on good food, that's very important, good food, and I pride myself on good CE, engaging speakers, the most important part is the dentist in the community seeing each other, talking to each other, and that is where you can meet more bads, more sads. So I'm going to kindly encourage you to come to the Dentist and Team Boost Festival, Jay.
Sign me up.
And Ariel, she said that, we recorded it, so that's good. And in all honesty, I really respect you as we've talked about implants, things like that. What are some things that you've gotten out of CE yourself? And, while that have just helped you as a dentist, a person, a professional, if you were saying, hey guys, I've been out for 10 years. If I went back in time 2 years out, I would do more of this, less of this. This is just more for our audience, some Jay advice.
I think hands down implant training, especially the kind of implant training that you provide, I think that kind of really sets the tone right for somebody, who's kind of fresh out of school and kind of trying to get an idea of what the general practice is all about. I think you do a fantastic job with your
Thanks.
program. A lot of digital dentistry is starting to
Yeah.
really come up with digital scanning techniques. A lot of guided dentistry is out there, so that's really picking up speed. I'd get into that. Digital smile design is something else that I'm kind of getting into, where patients love to see before afters.
Yeah.
We love, oh, I lost
Yeah.
50 pounds on Weight Watchers, and here's a before after.
Right,
Digital
exactly.
smile design does that for your smiles, and I think it's really a great asset to provide to patients. So those are some of the few CE courses that have really helped open up case acceptance and patient education for me. And I would if I could go back in time, I would have done that a lot earlier.
Yeah, and that's why I tell, and it's tough, but they go from dental school, you invest all these hundreds of thousands of dollars, but you can't stop investing in yourself, because that's how you pay back the hundreds of thousands of dollars and feel better about yourself. So I appreciate you sharing that with our audience. I love the part about before and after. I have my best friend here. You didn't see him before, but this is my best friend here, Jay. It's my phone. My phone is my best friend. Always does something interesting, but I said on a CE today, take videos of your patients so that you can show someone a completed case, get their permission. Because when someone's sitting in a chair saying, I don't know if I want to do veneers, I don't know if I want to do implants, you could say, oh, someone felt just like you. Here's a video of them. And that brings it to life just like this. So appreciate you jumping on with us, Jay. Dental Nachos Group, have a great Friday. One more time, two things. The Dentist and Team Boost Festival, April 24th, 25th. Awesome speakers coming to Philly. And to reach out more about this job, Ariel at dentalnachos.com and Jay at media.dental.
Media.dental. Jay at media.dental.
Ariel's going to say bye to you guys. Jay, stay on with me for a minute. Dental Nachos crew, I'm going to get ready for wine time.
Thank you so much, guys.
Fam. Thanks, Jay.
Take care. Thank you.
All right, Dental Nachoers, if you're interested in this position, be sure to reach out to Jay or I, and enjoy the rest of your Friday.